So let's talk about low back pain. I'd like to give you some really basic, fundamental osteopathic advice for managing and resolving low back pain. The fantastic fact is that 90% of back pain is muscular. Only 10% requires medical attention, and that means that you can resolve it by yourself without any operations or medication. So that's the best and first thing to understand. Even if you have an underlying disc condition or an underlying arthritic condition, still the majority of your pain is being caused by the muscles in your back responding and reacting to that change in stability. And if you can get yourself through a strong muscular rebalance program, the majority of your pain will resolve. Now, one thing I really want to get across to you, osteopathically, our motto is no diagnosis, no treatment. It's absolutely crucial that you get a diagnosis for your low back pain. You need to know what tissues are causing your pain. Is it a disc? Is it a muscular imbalance? Is it sacroiliac joints? Is it a facet joint? Is it arthritic? You need to know. So the first thing to understand is that non-specific low back pain, which is a commonly used diagnosis in the medical profession, is not a diagnosis. It's basically a description that you have low back pain, and it's not part of that 10% bracket. It basically puts you in that 90% bracket. Your next level of managing that diagnosis is to get a more specific diagnosis. And the only place you can get that is with an osteopath or a physio or a chiropractor, a manual therapist. Osteopaths spend 4 years training to diagnose low back pain. Doctors spend a few weeks. I had a clinic in Manchester a couple of years ago, and my local GP surgery used to refer their low back patients to me just for a diagnosis, just to help plan their management plan. So it's well accepted that osteopaths are very highly trained and be able to give you a specific diagnosis. Once you have a diagnosis, then you can start building your plan, and you can actually start seriously and quickly resolving your low back pain. If I don't have a diagnosis for a patient, I won't put my hands on them and I won't prescribe exercises. I have to know what is going on, and that might require scans, and it might require x-rays, and it will require, assessment. But when you get your diagnosis, you're in business.